swollen anywhere, assessing the patient's pain first. So we're gonna ask the patient, you know, do they feel like they need pain medication? So the dressing we're gonna remove, put it in our red bag. Then we're gonna do our sterile dressing change. But remember, with the dressing changes, you need to set everything up first and then put your sterile gloves on, okay? Does that make sense? Here, I'll just do it while we're here. So I think that we'll probably not, we're gonna irrigate, but not to the extent.
No banana pudding?
No.
Okay.
No. Okay, so I've removed the dressing, taken that off. Can you hand me my sterile gloves over there? So I'm putting my stuff over here. Do you remember for your dressing change last semester, did we, do you remember you didn't have to pack anything, right?
Nope, it was
So
just,
I'm gonna be measuring and
so like
sending
we're
this.
not doing the whole like with the bowl.
No.
Okay.
So 12 inches, and it's well approximated. So we're gonna be measuring, okay? And then, I mean, if you wanted, you could use this one too, but there's different options for measurement. You can, like if you were doing like a real, if we were gonna clean it, we could open this up. And this is our, so I'm gonna put my sterile glove, I'm gonna set everything up. So now that I've taken my dressing off, I'm gonna set everything up. And I've measured and done all that. So I'm gonna pour my normal saline, because remember that mimics the body's normal flora. I'm just gonna use this to kind of clean the wound off a little bit, okay? I'm not gonna reach over mine. So this would be considered a sterile field. So all these little packages would then be considered sterile field. Okay? So I'm gonna open this up. I'm gonna keep these all so that they don't flip over on each other and they can't be touching. I'm not gonna need Q-tips, but I might have you open a thing of Q-tips just so you can see how they. No, I'm not gonna have you open Q-tips because that's gonna be too much. Okay, so now I've got my sterile fields. The thing that people like to do a lot is overlap their fields, and you can't do that because they can't touch, remember? I'm gonna grab the inside. Okay. So this is sterile. I could have somebody, maybe I'm like, oh yeah, I might use those Q-tips, so they could open up a package of Q-tips for me. But I'm just gonna clean off the wound. Most of it's got it's a little goopy. So I'm gonna start at the top and clean down at a different place. Okay. I just wanna see your sterile technique. Maybe I want to dry it. So if I touch the outside, not touching the inside, I could maybe dab it on there and dry. Okay, dressing, touch the outside. You don't want to touch the inside. Cover it up. I'm going to tape it back on how like I had the other one. And then what else do I need to do with it? With the dressing?
The date that you changed.
Yeah, so I'm gonna let you guys write your initials, date, time, okay? I'm gonna let you guys actually do that. Tape it down. I like to tape it so that it's all the way around, okay? And
so
then
when we do that, do we like still have the sterile gloves on?
yeah, it doesn't matter at that time. You just wanna have some gloves on, and you've already got your sterile gloves on. You don't have to stay sterile at this point because you're on the outside. It's just, you want to stay sterile. You don't want to touch so when you go to do your normal saline, you just don't want to touch the side that it's going to, you're going to clean off.
Okay.
So if I just wanted to, and you can only use one area I'd have to kind of move it around and do a different area on here. that I wasn't touching. Okay, if I needed it, if that was needed. Then I'm gonna put my tape my tape around to secure it, and then documentation. So what are you gonna document? So what would we document?
The characteristics of the wound.
Mm-hmm. So what does it look like? How long was it? Do you guys remember?
12.
12 centimeters to end. It's a little red. Would say well approximated. How did the patient tolerate it?
Good.
What's their pain like? Did you offer pain meds before? This has staples in it. Are all the staples intact? You know, is there no redness? Is there redness? Drainage? What do you see? And I'm going to keep it kind of simple, but this one's going to involve, you know, doing good aided, instructing the patient as to what you're doing, and then showing me that you can keep your sterile field sterile and keep that as sterile as you can on coming onto the